Hello, my name is Dakota Archer, and my presentation is on understanding antibiotic resistance through natural selection. So antibiotic resistance is a massive and growing global health threat. It occurs when bacteria evolve the mechanisms that resist antibiotics and render any standard treatments ineffective, which will lead to persistent infections. So through this presentation, we'll explore the evolutionary mechanisms behind antibiotic resistance, which will emphasize its significance in modern medicine. A little bit of historical background here. Penicillin, the most well-known antibiotic out there, was accidentally discovered by Alexander Fleming in 1928. And some initial effectiveness in treating bacteria was found early on. However, after widespread use, became the first cases of resistance. So natural selection is the process by which organisms are better adapted to their environment, and they tend to survive and reproduce more offspring. So methicillin-resistant Staphylococcus aureus, or MRSA for short, is a type of staph bacteria that is resistant to methicillin and other common antibiotics, which make it a significant cause of hospital-acquired infections. So the natural selection process, we have variation, selective pressure, and the survival of the fittest. Genetic diversity within the bacterial population. The bacterial population are characterized by high level of genetic diversity, which arise from mutations and the exchange of genetic material. So the diversity will allow the bacteria to adapt to many different environmental challenges. Selective pressure. Antibiotic use creates an environment where resistant bacteria are able to thrive, not just survive. When antibiotics are used, they create a selective environment that favors the survival of the resistant bacteria. And while susceptible bacteria are eliminated, the resistant bacteria are able to multiply and continue to grow. Resistant bacteria survive and reproduce in the presence of antibiotics. Bacteria that have resistance are better suited to survive. Then these resistant bacteria will then reproduce and pass on their resistant gene to the offspring. So overuse and misuse in humans and animals. Humans are obviously primary cause of antibiotic resistance through overprescription and improper use of antibiotics, which then lead to the resistance and making infections more difficult to treat. The addition of antibiotics in livestock, which are used to typically promote the growth and prevent disease in the livestock, which allow the spread of drug-resistant bacteria. So resistant mechanisms, efflux pumps, enzymatic degradation, and target modification. Efflux pumps are proteins in bacterial cell membranes that actively remove antibiotics and other harmful substances from the cell. The pumps handle a variety of antibiotics, and which lead to resistance. Enzymatic degradation. Bacteria produces enzymes that destroy antibiotics. For example, beta-lactamase are enzymes that destroy the beta-lactam ring in penicillins and cephalosporins, which make them ineffective. So global impact, we got the health consequences, obviously, economic burden, and global spread. The increased morbidity and mortality is the primary concern when it comes to antibiotic resistance. When bacteria are able to resist antibiotics, the standard treatments will be less effective and lead to prolonged illness and higher risk of severe complications such as death. They have a higher healthcare cost and economic losses. The international travel and trade will contribute to the spread of resistance. Resistant bacteria are able to easily spread across borders through the movement of people, animals, and goods, which makes it a very difficult enemy to stop. I already touched on this subject before, but I just wanted to bring up another inappropriate prescribing technique that I have commonly seen is the prescription of antibiotics for viral infections, which antibiotics do nothing to reduce or prevent viral infections. And then there is the antibiotic stewardship. So rational use. Guidelines for appropriate antibiotic use need to focus on ensuring that antibiotics are prescribed only when necessary and with the correct dosage. There needs to be measures in place to prevent the spread of resistant bacteria and monitoring any antibiotic resistance patterns that are visible. Developing new antibiotics is important but challenging due to the scientific, regulatory, and financial barriers that are in place. Many alternative therapies are available, such as phage therapy, probiotics, and immunotherapy. Phage therapy actually uses viruses to target and kill specific bacteria, which offers a promising solution for antibiotic resistance. Probiotics is more of a preventative measure. It introduces beneficial bacteria to help gut health and reduce harmful bacterial infections. Immunotherapy enhances the immune system to fight bacterial infections using monoclonal antibodies, vaccines, and immune modulators. So some public awareness and education information. Public health campaigns are a very important part of raising awareness about antibiotic resistance and adding education programs to train healthcare professionals to focus on antibiotic stewardship, appropriate prescribing techniques, and effective patient communication. This could all lead to beneficial behavioral changes, which would be encouraging responsible antibiotic use. Interventions could be educating healthcare professionals on appropriate prescribing and implementing stewardship programs. And for the public, strategies involve promoting correct antibiotic use, such as completing prescribed courses and not demanding antibiotics when viral infections are the cause of the illness. So some future directions. Some innovative solutions. I think research into treatments and technologies is a crucial step in fighting antibiotic resistance, such as developing new antibiotics and alternative therapies. I think there should be a bigger international collaborative effort, such as collaborative research projects and pooling resources and expertise in order to tackle this global health threat. And policy development, I think strengthening regulations and policies is a very important part in order to control the misuse and overuse of antibiotics. I think including or enforcing prescription guidelines and regulating the use of antibiotics in agriculture, promoting stewardship programs, and healthcare settings. So, all in all, antibiotic resistance is a massive health threat that affects the entire globe, and we need a comprehensive approach to combat this. I think understanding resistance mechanisms and taking proactive steps can really help to preserve antibiotic effectiveness. Collaboration among healthcare providers, researchers, policy makers, and the public is very important. I hope you enjoyed. Thank you so much.